Hi, I'm Dr. Agrawal. I'm from the Division of Nephrology and Hypertension here at the College of Medicine at University of Vermont. I'm going to be talking about calcium and phosphorus regulation in the body. So how is calcium distributed in the body? Most of the calcium in the body exists in bone. So about 99.9% of the calcium is in the bones. That leaves about 0.1% in the blood. Now, of the calcium that's in the blood, 50% is ionized calcium. That is, it's not bound to anything, and this is the biologically active form of calcium. This is what regulates the various functions in the body, which I'll talk about in the next slide. And the body's going to do everything to try and regulate the level of the ionized calcium. The other 50% of the calcium in blood is bound to albumin and other anions like phosphate. Because calcium has a lot of functions, it's very important for the body to try and regulate it as tightly as possible. Some of the functions of calcium they have to do with nerve conduction, that is to generate an action potential. Calcium is also an important clotting factor and is needed for blood clotting here. Calcium is also involved in muscle contraction, you can see there, and it's also one of the important elements in bringing about release of hormones such as insulin and other neurotransmitters. Now, this is a good summary slide when we're trying to understand the calcium and phosphorus regulation in the body. I believe this is an important slide, and I really want to pay a little bit more attention to this slide because I think this can really help you solve any calcium and phosphorus problem that you come across either on the clinical side or on your exams. So let's look at these principles. The first thing is that a low serum calcium or the low ionized calcium, which we discussed is the active form of calcium, stimulates release of parathyroid hormone. An increased parathyroid hormone acts on the bones to cause bone resorption. Resorption basically means breakdown of bone to release the calcium that's bound in the bones. Parathyroid hormone helps increase calcium reabsorption by the kidney. Parathyroid hormone helps in activation of vitamin D and thus enhances 1,25-dihydroxy vitamin D production, and a parathyroid hormone tries to bring about phosphorus excretion by the kidney. The last principle to know is the 1,25-dihydroxy vitamin D, which is the active form of vitamin D, brings about increased calcium and phosphorus reabsorption by the gut. So one difference that you're going to see right away is that parathyroid hormone tries to increase the levels of calcium but will decrease the level of phosphorus in the blood. On the other hand, 1,25-dihydroxyvitamin D will bring about an increase in the levels of calcium as well as phosphorus by increasing the reabsorption from the gut. So that's one key difference to note about the parathyroid hormone and the 1,25-dihydroxyvitamin D and its effect on calcium and phosphorus regulation. And so if you just flip the arrows, you're going to see just the opposite of the last slide, that is, increased calcium level inhibits parathyroid hormone release. A decreased parathyroid hormone inhibits bone resorption, inhibits calcium reabsorption, so there is more calcium being peed out by the kidney, inhibits 1,25-dihydroxyvitamin D, and a low PTH inhibits phosphorus excretion. And a low 1,25-dihydroxyvitamin D leads to less calcium and phosphorus being reabsorbed by the gut. So let's try to look at these principles in a little more detail. So here's the thyroid gland. You can see that, and those are the 4 parathyroid glands that you can see just in front of the thyroid. And there is something in the parathyroid glands called the calcium sensing receptor. As the name suggests, this is a receptor on the parathyroid gland that senses the levels of calcium in the blood. And so, when there is a low calcium in the blood, this is sensed by the calcium sensing receptor, and this brings about parathyroid hormone release from the parathyroid gland, namely the chief cells of the parathyroid gland. On the other hand, if there is more calcium in the blood, that's going to be sensed by the calcium sensing receptor, and that inhibits the release of parathyroid hormone. Parathyroid hormone causes bone resorption. It does that by activating something called osteoclasts as opposed to osteoblasts. Osteoclasts are the cells in the bone that break down bone and allows the bone to release calcium and phosphorus into the blood. So you can kind of imagine the parathyroid hormone as a hammer that's breaking down the bone in this picture. The parathyroid hormone also has an effect on the kidneys, and what it does is the parathyroid hormone brings about calcium reabsorption in the distal convoluted tubule. You can see that there's a receptor there, and that promotes calcium reabsorption in the nephron. Parathyroid hormone inhibits phosphorus reabsorption at the level of the proximal convoluted tubule. That's the site where phosphorus normally gets reabsorbed. What about vitamin D? So vitamin D, a lot of us have heard about why it's so important to stay out in the sun, and it's because the ultraviolet B rays act on a form of cholesterol called 7-dehydrocholesterol in the skin to generate vitamin D3. Also, vitamin D3 is present in a lot of our foods, milk, orange juice, and that's how vitamin D gets into our bloodstream. However, vitamin D3 needs to be activated. There's a vitamin D3 binding protein that takes this to the liver. There is an enzyme in the liver called 25-hydroxylase, which, as the name suggests, adds a 25-hydroxyl group to vitamin D, and so you now have 25-hydroxyvitamin D3. When that goes to the kidney, the proximal tubule cells have another enzyme called 1-alpha hydroxylase, which then, again by the name, it adds a 1-alpha hydroxyl group to the vitamin D3, and then you end up with this 1,25-dihydroxyvitamin D3, which is the active form of vitamin D. This 1,25-dihydroxyvitamin D3 is also known as calcitriol. For vitamin D3 to be converted to the calcitriol, it has to go through 2 steps. That is the 25-hydroxylation and the 1-alpha hydroxylation before it becomes active. And parathyroid hormone acts on the kidneys. It brings about increased activation or increased activity of the 1-alpha hydroxylase, thus enhancing generation of the 1,25 dihydroxyvitamin D3 or the calcitriol, and thus assisting in the calcium and phosphorus reabsorption from the gut.